So first is to prepare all equipments that we're going to use throughout the demonstration, such as the wooden tongue depressor, cotton applicator, the pen light, millimeter ruler, the OPA card or index card, the gloves for infection control, then the flashlight, the improvised otoscope and tuning fork. Then next is to introduce myself. Ma'am, good morning. My name is Janimir A. Amat, your future RN. I am going to perform an assessment in your nose, ears, eyes, and mouth. It is very necessary to assess this specific area or parts to monitor the normal characteristics and functioning of it, because there are some instances that it may show or indicate health problem if there is any presence of infections or abnormalities. I am hoping that you will going to cooperate by listening and following from any instruction. Next is to perform a hand hygiene before and after the assessment. And you may also observe other appropriate infection controls such as wearing masks, eyewear, and gloves if it is necessary. Then next is to provide client privacy by ensuring closing the door, checking the curtain, and the window. It is also important to ask the client if she or he is comfortable from the position that he has or she has. Ma'am, are you comfortable sa position niyo po? Opo. Opo. Then next po is to ask the client about or inquire some questions about the health history of the client. Ma'am, do you have any, what is your name po pala muna? Your name po is?
Jonas Torga-Amat.
How old are you, ma'am?
18 years old.
Do you have any family history of hypertension or high blood po?
Yes po.
Yes. Then diabetes po? Meron din po ba?
Wala naman.
Blood dyscrasia or nag-lead into stroke, meron po ba?
Meron po.
Meron. Then, when it comes to your eye problems, do you have po ba? Or surgery, nagkaroon ng surgery sa eyes? Wala.
Family?
Sa'yo po?
Wala po.
Then, yung medications, meron po ba kayong tinatake? Gumagamit ng contact lens, meron po ba? Wala. Then, nagkaroon po ba ng any consultation sa ophthalmologist?
Wala po.
Wala naman. Then sa nose niyo, meron po ba kayong any allergies?
Wala naman.
Wala. Tapos sa sinus infection, meron?
Wala po.
Wala. Tapos sa dental, when it comes to your dental care po, meron po bang routine for a dental care?
Anong routine?
Nagkakaroon po ba ng any consultation para sa dental care, ganun, like annually or monthly, pupunta sa dentist?
Wala naman po.
Wala. Tapos, merong dental problem, meron?
Meron po.
Meron? Like?
Decades.
Decades. Tapos, merong hearing problem?
Wala po.
Hindi ka nahihirapan makinig, ganon?
Hindi po.
Tapos, nagkaroon ng changes sa smell?
Wala naman.
Wala naman. Merong any consultation sa dentist?
Tita?
Kailan po yung last na consultation? Meron. So, yun lang. Thank you for answering all those questions or inquiries about your health history. Then next, we may now proceed for assessment. So the first assessment is the assessing the eyes. It is divided into 4 sections. So the first section is we need to assess the external eye structure of the client. So the first one is to inspect the client's eyebrows. The eyebrows should, the hair of the eyebrows should evenly distributed. So inspect if it is evenly distributed. Then the alignment, if it is symmetrically aligned. Then the skin quality beneath the eyebrow, if there is any presence of discoloration, discharge, or there is a presence of scaling or flackiness. And lastly, the symmetry, movement of the eyebrows. So ma'am, pwede niyo po bang erase slightly yung eyebrows nyo? Raise. then i-lower nyo naman po. So, basically, after assessing the eyebrows, the hair is evenly distributed, the eyebrows is symmetrically aligned, then there is no any presence of discoloration, scaling, or flackiness, and lastly, the movement of the eyebrows is symmetrically. And next is we need also to inspect the eyelashes. The eyelashes the hair of the eyelashes should be evenly distributed also, and the direction of the eyelashes should be in the outward direction. So, in assessing it, the eyelashes of the client is directly on the outward direction. So, there is no any normal deviation from a normal, which is in a inward direction. Then next is we need to inspect also the eyelids of the client. The eyelid may be inspected through the texture, the surface, and also the blinking action or movement of the eyes, the eyelids. Then the eyelids have no any presence of lesion. Then ma'am, pwede nyo po bang i-close yung eyes nyo po? Then inspect or observe if the eyelids is symmetry from the opposite eyelids, from the other eyelids. So the eyelids is symmetrically from the other one. Then next is to inspect the bulbar conjunctiva of the eyes. So ma'am, will you please open your eyes? In inspecting the bulbar conjunctiva, it is the transparent one that is on the top of the sclera. So the normal bulbar conjunctiva has a transparent color, and it is also important to inspect the color of the sclera because there are some deviations from the normal color that the sclera indicating, such as the yellowish, which is known as the jaundice, in that it also indicating for a liver problems. And also there is some instances of having a red color, which is indicating for rheumatoid disease. And other naman po is there are some sclera that has a color of paleness, which may indicating for anemic or deficiency of iron. So the bulbar conjunctiva color is shiny, and also it is transparent. And next is we need also to inspect the palpebral conjunctiva. The palpebral conjunctiva is located inside the upper eyelid and the lower eyelid. In inspecting it, we need to invert the eyelid of the client. So ma'am, will you please look upward? Then check if the color of palpebral conjunctiva is pinkish one, which I'm referring for a normal color, and check if there is any presence of lesion. Then ma'am, will you please look downward? So there is no any presence of lesion. The palpebral conjunctiva is clear from any abnormalities. Then aside from that, we also need to inspect and palpate the lacrimal gland of the eyes, which is the lacrimal gland is located at the lower portion of the eyebrows. So we need to palpate it for the determining of any tenderness or edema. And next is also to palpate the nasolacrimal sac up to the nasolacrimal duct. You may use your index finger. So there is no any presence of tenderness, edema, or swelling from the lacrimal portion of the eyes. Then next is to inspect the corneal clarity and texture. In assessing it, we need to instruct the client na, ma'am, will you please look look straight forward. Then we need to use pen light. By holding the pen light in an oblique angle and slightly move the pen light into across to the cornea of the client. So, check. Check mo ka. From this to so the corneal clarity and texture of the client's condition is shiny, transparent, smooth, and the iris is visible. So next is to perform a corneal sensitivity reflex. It is very important because we try to determine the functions of cranial nerve 5, which is known as trigeminal nerve. In this part, we need to use the cotton applicator, and it tries to determine the reaction of the eyes, the ability to react of the eyes from any sense of touch. Ma'am, will you please check ko lang kung magre-react easily yung eyes ko. Open niyo lang po. Open niyo lang po. Open muna. So, obviously, the corneal or the trigeminal nerve of the client is functionable, and it easily reacts from the cotton applicator. Then next is to inspect the corneal, the anterior chamber of transparency and depth of the cornea. It is also important to assess this because from this anterior chamber, it is referring for the pupil and the iris part of the eye, which we need to use the pen light, and the light should pass from the iris and the pupil, and there should no any shadow that may reflect from the other or from the side of the pupil. Because if there is any shadow or darkness, it may show or indicate glaucoma. So, ma'am, will you please look straight forward? Then from the other side. So, the anterior chamber of the transparency and depth of the client of the eyes is in a normal or there is no any presence of shadow that reflected to the pen light. Then next is to inspect the pupil color, size, and symmetry. It is important to check the color. The normal color should black. So the client's color pupils is black. Then the size varies into 3 to 7 millimeter diameter. If it is in a normal size. So the size of the client's pupil is 5 millimeter in diameter. Then aside from that, we also need to check the symmetry of the pupil if it is equal to the other side, because there are some deviations such as the meiosis, which is the pupil is too small And while the other one naman, if it is too large, it may indicating for mydriasis. And if it is not equal in the size of the pupil, it may referring for anisocoria. And next is we need to perform or to assess the pupil's reaction to the light, or it is also known as the consensual response or reaction of the pupils. So we need to use a pen light again, and the pupil, when the pen light is directly spot to the pupil, it should constrict while if the light is eliminated or tinanggal na, the pupil should dilate or go back from its normal size. So let's see. So the pupil constrict. Other one, the right. The pupil constrict and eliminated. Constrict and eliminate or dilate. Then, to assess the pupil's reaction to accommodation. By this time, we need to use object or a fingers to check the pupil's reaction when there is an object at the near place of the eyes. Then place it in 10 centimeter away from the pupils. Yung pupils, it will constrict when the eyes look in the near object, and direct the client to ma'am, tumingin ka po sa malayo and check if the pupil is dilated. So, tingin po dito. Then, the pupils constrict. Then, tingin po sa malayo. Then, the pupil eliminate and the pupil dilate. So, in recording the normal assessment for the pupil, we may use the abbreviation of PERLAC, which means pupil is equal round reactant to light and accommodation. Then next is to have an assessment for the visual fields of the client. By this time, we need to use the opaque card or index card. So, we need to, in a sitting position, have a distance for at least 60 to 90 centimeters away from the client. Then, please command the client or direct the client to place it on here, on her left eye. Left eye. Yeah. Then, place din po in the opposite dun sa client. Then, assess the peripheral fields of the client from the temporal. Nakikita niyo po ba? Then, the temporal fields have a normal angle of 90 degree, 70 degree. Then, sa cheek naman, then, repeat it on the other side of the eyes. Then now, we may proceed to the assessment of the third section for assessment of eye is the 6 ocular muscle test. It is very important to test the 6 ocular muscle that our eyes have, because it is responsible for the movement of the eye, in which we need to use the 6 cardinal fields of gaze. From ma'am, tingin ka po dito sa pin light and follow po the movement that the pin light will have. Then from right upper, then left lower, left upper, then the right lower, then right and left. It is very important to have a period every side, because we need to determine if or observe if there is any shaking or involuntary movement of the eye that may show or indicate the disorder of nystagmus. So, after assessing, the client doesn't have any involuntary movement or shaking when the ocular muscle test conducted. Then next is to perform the Hirschberg test. This we tries to check the alignment of the pupil when it reacts to the pen light. If it is if there is any disalignment of the pupil. So the pupil don't have any disalignment or nag-iba ng position. It only follow the reflections of the light. And lastly is to assess the visual acuity of the clients. From this time, we need to use this Snellen chart. And ma'am, pwede ka po bang tumayo and the client should have a distance at least 20 feet or 6 meters away from the Snellen chart. And by the use of index card, we need to cover we need to uncover the part or portion of the eye that is not tested. So, paki-cover po yung right eye. And then, we need to check the visual acuity of the left eye. Then, pakibasa po yung pinaka nababasa niyo po from F. P.
FELOPZB DEFPOTEC LEFODPCT FDPLTCEO PEZONCFTD.
And from repeat po sa other side.
FELOPZB DEFPOTEC LEFODPCT FDPLTCEO PEZONCFTD.
So, ma'am, may you please uncover uncover the eyes and read the letters by your both eyes.
FELOPZB DEFPOTEC LEFODPCT FDPLTCEO PEZONCFTD.
So, obviously, the visual acuity of the client can be able to read 10 feet away of the from the smallest letter that the Snellen chart have. So, the last portion of the assessment of the eye is to document all the information or findings that you have from the eye assessment for the patient record. Next is to assess the ears and hearing. In assessing the ears, we need to inspect the client's auricles, color, symmetry of size, and the position. So the color of the client's auricle is same as the facial color. Then the size, it has an equal size of the opposite side. Then the position of the auricles should be aligned to the outer contour of the eye. So to check if it is aligned, we need to use the millimeter ruler and check horizontally if it is aligned. Very good. Then the auricles, the client's auricle is aligned to the outer contour of the eye. Then we may also check the position of the auricles vertically by having a 10-degree angle. This means that the position of the client's ear is in a normal position or alignment, because there are some deviations that may show or indicate if the position of the auricle is in the low set, which may indicate such as the congenital abnormalities like Down syndrome. Then, aside from it, we may also palpate the auricle for the presence of tenderness, checking the texture and the elasticity. So, do you feel any tenderness? Walang sakit?
Walang.
Then the texture, it is smooth. There is no any presence of tenderness. And the elasticity, we may pull the auricle upward, downward, backward, and we may fold the auricle, the pinna, forward. The auricle recoil faster or back it to the normal state when it recoils. Then after that, we need to inspect the ear canal. If there is any presence of cerumen, lesion, blood, and pus. So we don't have otoscope. We just we may use the flashlight. So in checking this, we may pull the pinna upward so that the position or the vision for the ear canal may be C or C. B, ayos ah. There is a presence of cerumen, but there is no presence of blood, pus, and lesion. Masakit ba tenga mo, B? Hindi naman. Check the other side also if there is presence of cerumen, pus, blood, or lesion. So, there is a presence of cerumen. B, hindi ka naglinis, no? Then, after that, we may also inspect the tympanic membrane of the ear. In this, we try to check the color and the glossiness of the tympanic membrane. But since we don't have otoscope, we can be able to assess the tympanic membrane of the client. Then, after that, we may perform the hearing acuity test. By this, we try to determine the hearing ability or the ability of the clients to hear easily for the normal sounds or normal voices. We may perform this by directing the client na, ma'am, pwedeng pa-close mo yung other side mo. Tapos, sabihin mo sa akin kung ano yung, hindi yung mata, sabihin mo sa akin kung ano yung narinig mong word, ha? May sasabihin si ate, sabihin mo kung ano yung word na yon, ha? Tapos, close mo yung isang ears mo. Yan. May sasabihin si ate, ha? Tapos, sabihin mo sa akin kung ano yung word na yon. Apo. Ano yon? Narinig mo? Ano yung sinabi ko?
Masyalas.
Yung English, no? Ano yung pinaka narinig mo? Apple. O, sa kabila naman. Banana. Ano yung narinig mo?
Bananas.
Banana. So, yun. That is how to perform the hearing acuity test. So, next, there are also other hearing test that is performed, which is known the tuning fork test. This, we need to use the tuning fork equipment, but unfortunately, it is not available, and I am just going to explain how it is being performed. So, the tuning fork test, it has two types, which is the Weber test and the Rhine test. The Weber test, it tries to assess the bone conjunction by examining lateralization. So, yung tuning fork, hawakan siya sa base nun. Then, yung base, iahampas sa any surface, and it is placed to the forehead or to the upper head part of the client. So that i-ask kung meron bang na-feel na any vibration si client or sounds. Then, on the other hand, yung Rhine test naman, it is performed to assess the sound conduction through the air, or the air conduction by the sound conduction of the air. Then, the tuning fork is placed to the back of the ear. So, in a normal deviation for the testing between the Weber test and the Rhine test, the air conduction should be greater, the air conduction hearing should be greater than the bone conduction hearing. And document all the, for the last part, it is important to document all the findings from the assessment of the ear for the patient record. Next is to assess the nose. In assessing the nose, we need to inspect the external nose color, size, shape, and even for the discharge of the on the nose. So on the nariz. So the color of the nose is same as the or uniform to the facial color. Then there is no any presence of redness. The shape, it is symmetry to the other one, and there is no any presence of enlargement. Then there is no any discharge. The next is to palpate the external nose slightly for the presence or for checking if there is any presence of tenderness. Masakit eh? Then check the looking or displacement of the bone and cartilage. Then next is to observe or to inspect the patency of the nasal cavity. By this, we need to instruct the client to close the mouth and close mo yung mouth mo. Close yung mouth. Close yung mouth for the pressure. Then, check kung breathe ka. Nag-breathe ka. Hinga. Tapos yun. Sa kabila naman, so, obviously, the clients can breathe without any obstruction from the of the nose. Then the air moves freely on the nose. Then after that, we need to inspect the nasal cavity of the client. By this, we need to use the other hand to assist the client's head to tilt back. And for the flashlight or the pen light, any available, if there is any availability. Then the nasal cavity, check for the nasal lining and observe for any presence of redness, swelling, the growth of the hair, discharge. So there is no any presence of redness. The hair growth is enough. It is not too thick. Then there is no any discharge or present, and also the presence of lesion. And aside from that, we need also to inspect the nasal septum between the nasal chamber. So the nasal septum is intact in the midline between the nasal chamber. And lastly, we need to palpate the 4 nasal sinuses for the presence of tenderness. So, tingnan natin. The first one is the frontal sinus. Sabihin mo pag masakit, ha? Frontal sinus. Then the ethmoidal, the maxillary sinuses. Masakit? Hindi naman. So there is no any presence of tenderness. And after that, document all the findings for the patient record. For the last assessment, we need to assess the mouth of the client. We need to inspect the external lips of the client, because it is very essential to check the lips color, symmetry, the moisture or texture, because since the lips, it is a vascularized part, meaning to say it indicate or shows the circulation on our body have, if it is in a normal state or not. So the color of the client's lips is pinkish. It is slightly dry. Then Bimit, will you please pout your lips like para nagwi-whistle ka, gano'n. So it is symmetrically isa pa. It is symmetrically from the other, the both side of the lips. Then next is to inspect also the buccal mucosa, or the inner part of the mouth, which we may use the wooden tongue depressor. By inspecting it, we need to check the buccal mucosa color, texture, if it is well moistened, and if there is any presence of patch, white patch or lesions. So check. So the inner lip, the inner buccal mucosa of the client is color pink. It is well moistened. There is no any presence of lesion or patch. Then we may also inspect the teeth and gums of the client at the same time. So the teeth of the client, there is the normal number of the teeth that we have in the adult is 32. While if it is in a infant or a baby, they have only 20, which is also known as the dentures of teeth. Then the client teeth has a accumulation of plaque, and there is some cavities, and there is a break of the teeth on the premolar part, which is at the end. Then isang tanggal ng ngipin sa canine part, sa right canine. Then the gums, the color of the gums is pink. There is no any presence of lesion or redness that may indicating for inflammation. Then next, we need to inspect the tongue, the color of the tongue, texture, and also the movement of the tongue, if it is well mobility, or there is no any tenderness or difficulty for the movement. Let's check your tongue. So the color of the tongue is slightly white or pinkish, light pinkish. Then there is no any presence of nodules. Then the texture, it is well moistened. Then shiny. Then we also need to check the lower part, or the lower part of the tongue and the frenulum. So taas mo yung, yan, very good. So the color is pink. There is no any presence of lesion. Very good. And then we also need to palpate or to instruct first the client to check the mobility of the tongue. Side mo yung tongue sa kabila. Move your tongue from the right side. Right? Yeah, very good. So the tongue is well mobilized. there is no any difficulty for the movement. Then next is to palpate the tongue for ensuring if there is any tenderness or lesions that is present of the tongue. Papalpate ni ate, hawakan ate. Very good. So, next is to inspect the salivary glands of the client, which is the there are 3 salivary glands that is present on our mouth: the submandibular, submental, and the parotid gland. So check if there is any inflammation from it. So dito. So check yung duct, yung salivary gland duct na present sa may parotid, the submandibular, and the submental. Check ni ate ha. Ay, sorry. So there is any inflammation, swelling, or presence of edema. The next is to inspect the uvula and the palates. So the uvula, the uvula is the one that is like a punching part of the mouth. There are 2 types of the palate, which is the soft and hard palate. So in checking it, we need to inspect the color if it is uniformly to the other parts of the mouth. So check natin what's the color of the uvula. Labas mo yung tongue mo, labas. Yan, very good. Tapos press the tongue to check the uvula. So it is color pink. Gan, very good. Tapos gan. Then we may use light if it's for the visibility of the other appearance. Labas mo lang. Then, in checking the soft palate, we may instruct the client to say and the soft palate should rise up. So sabihin mo head tilt muna, head tilt, ganon. Tapos say So obviously the soft palate raise up. Then next is to inspect the oropharynx and the tonsil. It is essential to check or to inspect the tonsil if there is any inflammation, because the tonsil, it is the responsible for the filtration for any pathogens that enter into our passage of the mouth. So the tonsil is located at the beneath the side by side of the end of before the oropharynx. So tapos the color of the tonsil is well uniformly to the soft and hard palate. Then the oropharynx, it doesn't indicating for any inflammations. There is no any inflammations for the tonsil, and the oropharynx has its well moistened, and there is no any presence of lesions. Document all the informations that you gathered or the findings from the assessment for the patient record.